This is CVPR 601 Professional Behaviors, and today we're going to talk about guidelines. And the guidelines we're going to talk about today are from the Extracorporeal Life Support Organization, or ELSO. I hope you've had a chance to read a brief introduction or to watch a brief video that's in your learning module on ECMO. ECLS is largely considered ECMO, and you can see that they're sort of interchangeable words here. ECLS, extracorporeal life support, and ECMO, extracorporeal membrane oxygenation. So these are the guidelines by this organization. This is a very large organization. ECMO has grown tremendously in the last 10 years. And so to review briefly, a few terms, a guideline is used to assist us in developing our own protocols. So these ELSO guidelines are here to help us and provide for us information that we can use in developing our own institutional guidelines. So again, just for that review, these are guidelines. These are to help provide a framework, a reasonable framework in developing protocols. Most institutions that are starting an ECMO program will go right to these guidelines to begin to build the protocols that will help them conduct ECMO with their institutions. Let's take a look at these. We've looked at the AMSEC standards and guidelines. And let's just take a look through the ELSO guidelines. And you have the web link in the learning module. It's got a few overarching contents: patient conditions, extracorporeal circuit. That sounds interesting for us. That's going to include all sorts of things on the components, the pump, the lung, sweep gases, priming. Oh, this looks really good. Another heading on vascular access, very important with cannulation. And then management during ECMO or ECLS, blood flow, oxygenation, circuit monitors, alarms, and safety. We'll take a peek at that. So this is really chock full of really good information for anybody that's looking for something to help guide them in a management of ECMO. So let's take a look. Let's look at the pump. So one of their guidelines is it should be able to provide full flow to the patient. A couple interesting tidbits here. The inlet line occluded suction pressure should not exceed -300. So this gives us a little parameter there. That's a really deep negative pressure on the inlet side of a centrifugal pump. The outlet pressure should not exceed 400 millimeters of mercury, and you may have seen that that we have set some of on the bypass machines, our limits are up around this level. We try not to exceed that. Pump should have battery of 1 hour operation and a hand crank in the event of a power failure. The pump and circuit should have a mechanism to alarm for or prevent reverse flow. There's a section on the membrane lung, which is also called the oxygenator, of course. We have to size these oxygenators to our patient populations, whether they're adult, pediatric, or infant that require ECMO. So this has a lot of really good information. And we can actually probably compare some of this from our own standards and guidelines. So what I'd like you to do is to read through these standard of guidelines, and especially pay close attention. I'm sorry about the rapid scrolling, but pay close attention to some of these elements of Section 2, the extracorporeal circuit, the cannulation, and then the management section, very important. Looking at the safety, talks about what happens when you hit a high pressure. What about air in the circuit, clotting in the circuit, power failures, decannulation? This is a lot of crisis I really like this little addition here. Emergency drills addressing all these problems should be conducted by the team at regular intervals. Do the emergency drills. This is an incredible aspect of what we're trying to inculcate into each one of you, is that we need to be more like pilots. We need to go to the simulation room and practice these emergencies. When you get out into the field, you are going to find that emergency drills are not that often done, and we're trying to change that culture. We actually see it more in ECMO than in bypass. So these low volume, high risk events should be practiced. So I want you to read this over. We're going to discuss this in class and talk about, highlight some of the similarities and differences between our own cardiopulmonary bypass standards and guidelines. So thank you very much. Look forward to talking to you about this. I will not have a quiz on this section. So you're off the hook, and look forward to discussing these guidelines with you tomorrow.